We often think of crying as the ultimate sign of sadness, joy, or relief. We see it in movies, read about it in books, and experience it in our own lives. But what about the people who never cry? It is incredibly easy to label them as cold, heartless, or emotionally detached. However, the psychology behind a tearless life is far more complex and deeply human than we might realize. Today, we are going to explore the psychology of people who rarely or never cry, breaking down why it happens and what it really means about their emotional inner world. One of the most common reasons someone might stop crying is deeply rooted in their childhood and cultural upbringing. From a young age, many people, especially men, but certainly not exclusively, are taught that crying is a sign of weakness. Phrases like toughen up or stop crying condition the developing brain to associate tears with shame, embarrassment, or punishment. Over time, this conscious effort to hold back tears becomes an unconscious habit. The person doesn't just stop crying in front of others. Their brain actually learns to shut down the physical response of crying altogether, even when they are completely alone and feeling profoundly sad. For others, not crying is a psychological defense mechanism born out of trauma or chronic stress. When a person experiences overwhelming, prolonged emotional pain, the brain sometimes employs a survival strategy called emotional numbing. It is the mind's way of pulling the plug to prevent a total emotional system overload. In these cases, the individual might feel a deep sense of emptiness or apathy rather than acute, sharp sadness. They might actually want to cry to feel that sense of relief, and they might even feel the physical heaviness of grief in their chest. But the tears just won't come. Severe depression can also cause this. While we often associate depression with endless tears, it can sometimes flatline a person's emotions entirely, leaving them trapped in a tearless void. There is also a fascinating psychological trait called alexithymia, which literally translates to no words for emotions. People with high levels of alexithymia struggle to identify, understand, and describe their own feelings. Because they have difficulty processing internal emotional signals, their bodies often do not trigger the physical release of crying. It is absolutely not that they do not feel anything. Rather, their emotional processing system is simply wired differently. They might experience the stress of a sad event as physical discomfort, like a stomachache, extreme fatigue, or a tension headache, instead of shedding tears. It is also crucial to acknowledge that sometimes the inability to cry is purely biological or medical rather than psychological. Certain medications, particularly some common antidepressants, are well known to blunt emotions and physically prevent people from crying, leaving patients feeling emotionally blunted. Additionally, autoimmune medical conditions like Sjogren's syndrome affect the body's moisture-producing glands, physically drying out the eyes and making the act of crying physically impossible. In these scenarios, the lack of tears has absolutely nothing to do with a person's emotional depth or psychological health. Ultimately, the assumption that no tears equals no feelings is a massive misconception. People who never cry experience a full, rich spectrum of human emotions. They just process and express them differently. Some might channel their grief into intense physical activity, creative art, or hyperproductivity, while others might simply sit quietly with a heavy heart. Understanding this helps us become more empathetic friends and partners. Instead of judging someone for not crying at a funeral or during a heartbreaking moment, we can recognize that their dry eyes might be hiding a story of deep conditioning, silent trauma, or quiet resilience. Tears are just one way to express pain, but they are certainly not the only way.